It would be actually more unusual to have somebody who just went straight through from start to finish with their therapy without having these wobbles along the way. And because I've done it for many years, you can hold the person through that and often reassure them this is just normal. But if the therapist doesn't know that and the client doesn't know that, sometimes the whole thing can fall down. So being aware that might happen is the first step, but then knowing that you can work through those little glitches right through to the next stage of therapy or to the end of therapy is the second really important step. And it's because nearly all therapy, psychotherapy as well, or any kind of physical therapy, but especially with voice therapy, we're walking a dual track. We're walking the track of voice therapy and training and exercises and all that entails. But there's also a path running parallel where the person has feelings that come up about their voice, emotions, memories, all sorts of things, generally in the category of emotion and psychology. Sometimes they're doing well with the exercises, but the emotional stuff is dominating and it can tend to block people. So that track is not really progressing. And then when that track doesn't progress, eventually this track won't progress very well. So what happens when somebody's tracks are out of alignment? They're not moving at the same time. Like I said, it's part of the course with voice therapy, but they need to be explored. So what happens when the tracks aren't running parallel and one is going ahead and one is getting stuck? And actually, if emotionally somebody gets stuck in voice therapy, then the other track will stop too.